Welcome to another deep dive with us. This time we're heading all the way to Assam in northeast India.
Beautiful part of the world.
It really is, yeah. And we're diving deep into their healthcare system.
Right.
Now, when you think of Assam, you might picture those stunning tea gardens.
Yeah.
The rolling hills, the Brahmaputra River, very picturesque.
Absolutely.
But behind that idyllic image, there's a complex reality.
Yeah.
Over 75% of Assam's population lives in rural areas.
Wow.
And they face some really, really significant challenges when it comes to accessing healthcare.
Absolutely. And that's what makes this deep dive so fascinating, right? Because Assam's healthcare system, it really reflects the broader challenges and opportunities that India faces as a whole. How do you balance these ambitious government initiatives with the realities of a diverse and geographically challenging terrain?
Yeah, and I think we should start with that.
Right.
Just to kind of set the stage.
Sure.
I know India has this 3-tier public health system. So how does that actually play out in Assam? Where do things start to, maybe not work as well as they could?
Okay, so imagine like a pyramid, right?
Oh.
At the very top, you have the tertiary care level. So that's where you've got these advanced specialized hospitals.
Okay.
In Assam, you've got 9 government medical colleges and hospitals.
Okay.
These are like the big ones for cardiology, neurology, oncology.
So like the high-level stuff.
Exactly.
Okay.
Now, as we move down this pyramid, you get to the district and community health centers.
Mm-hmm.
They offer secondary care, so kind of a step down.
Yeah.
And then right at the base of this pyramid, you have the primary health centers and subcenters.
Okay.
And these are absolutely critical, especially for rural communities and the tea garden workers that we were talking about.
So those are the ones on the front lines.
Exactly, the lifeline.
But I have a feeling those primary health centers at the bottom of the pyramid are facing more than their fair share of obstacles.
You're absolutely right. I mean, the system looks good on paper, right? 3 tiers, very organized. But the reality is, Assam's a tough place.
Oh, okay.
I mean, imagine this. It's monsoon season, and a pregnant woman in a remote village needs urgent care. The nearest primary health center could be miles away. The roads are flooded. There's barely any transport.
Yeah, you don't really think about those things until you're in that situation.
Absolutely. And for many in Assam, that bias the situation.
It's pretty mind-blowing when you think about it.
Yeah.
So with these challenges, how is the government even starting to address this? I know there are these national programs, Atal Amrit Abhiyan, Ayushman Bharat, aimed at expanding healthcare coverage. But I mean, are they actually reaching the people who need them most? That's the real question, isn't it?
Right, and those are absolutely essential initiatives, no doubt about it.
Yeah.
Take Atal Amrit Abhiyan, for example. That program provides free healthcare coverage up to 5 lakh rupees per family every year.
That's a substantial amount.
Yep, it is. And then you have Ayushman Bharat focusing on the economically vulnerable, offering cashless treatment.
Okay, so the intentions are good.
They are. But as we've seen with that monsoon scenario, it's the implementation that's the real battleground, isn't it?
Yeah, and that's something we see time and time again, right?
Absolutely.
Well-intentioned programs, they sound amazing on paper, but translating them into real benefits for people in these remote villages.
Right.
That's a whole other story.
Exactly. You've got to consider the accessibility, the affordability, the awareness. It all comes into play.
So Assam's unique challenges, let's talk about those a little bit more, right?
Okay.
We've talked about the geographic hurdles, the reaching those in these very, very remote places. What are some of the other, I guess, key issues that are really plaguing Assam's healthcare system?
Okay, well, one of the most urgent issues is the severe shortage of doctors.
Okay.
And this is especially bad in rural areas. The current ratio is 1 doctor for every 1,700 people, which is far below the World Health Organization's recommended standard.
That's a massive gap.
It is. And just think, if you're a doctor posted in a remote village, limited resources, no support staff, poor infrastructure.
That's isolating.
Exactly. Not exactly a dream job, is it?
Yeah.
And that's why attracting and retaining talent in these areas is so, so difficult.
Yeah, and it makes me think about another thing we mentioned earlier, that Assam has India's highest cancer rate.
Right.
Is there any connection between that scary statistic and this doctor shortage that you're talking about?
It's not a direct link, but it does show how complex the healthcare situation is in Assam.
Okay.
The doctor shortage obviously impacts timely diagnosis and treatment for everything.
Right.
But the high cancer rates, those point to a whole different set of problems.
So it's not just about getting people to hospitals. It's also about addressing the root causes of why they're getting sick in the first place.
Absolutely. Think about the cultural practices there.
Okay.
The widespread use of tobacco and betel nut, major contributors to oral cancer. And it's deeply ingrained in the culture.
So it's a multi-layered problem.
Absolutely. It's not just build more hospitals. It's about lifestyle prevention.
A whole mindset shift.
Exactly.
That's a lot for the government to handle.
It is.
So beyond what we talked about, the Atal Amrit Abhiyan, the Ayushman Bharat,
right.
What other specific programs are they implementing to address these challenges?
Right.
Especially the cancer and the maternal health issues.
Okay, well, besides those financial coverage programs, they're definitely making a targeted effort to fight the cancer burden.
Okay.
The Assam Cancer Care Foundation, for instance, is working on setting up 17 new cancer care centers across the state. So moving beyond just Guwahati, spreading out the resources.
That's good, trying to decentralize.
Exactly.
What about maternal and child health? Assam struggled with high mortality rates in those areas.
You're right, and they've launched several programs for that, like the Janani Suraksha Yojana, the Mamoni and Majoni schemes.
And what do those do?
Well, they try to incentivize institutional deliveries, offer free maternal care, provide financial aid to expectant mothers.
Okay, so a lot of support for mothers and their babies.
Absolutely, but again, it comes down to how effectively these programs can overcome the existing hurdles.
Yeah, it's like a broken record at this point, right?
It is.
Good intentions, but that last mile of implementation is the toughest part.
It really is. It's not just about saying, here are the services. It's about making them accessible, especially during those tough times.
Right, like a village cut off by the monsoons.
Exactly. Even if a woman knows about these programs, wants that institutional delivery, how does she even get there?
Yeah, you can't just snap your fingers and make the infrastructure appear.
Exactly. So many factors at play. Infrastructure, transport, even just awareness of what help is available.
It's a powerful reminder that healthcare isn't just about policies and programs.
Right.
It's about making sure those policies actually benefit every single person.
Absolutely.
No matter where they live or what their circumstances are.
Couldn't have said it better myself, and that brings us to a really crucial question.
Bogey.
If the government can't solve this massive puzzle on its own, can the private sector help? Can they bridge these gaps?
Now that's what I call a cliffhanger. We've laid out the government's efforts, the massive challenges they're facing.
Right.
And now the question is, can the private sector step up and offer some solutions to this very, very complex problem?
And that's exactly what we'll be exploring in the next part of our deep dive.
So stay tuned. Welcome back to the deep dive. We just explored the government's efforts in trying to provide accessible healthcare across Assam.
A massive undertaking.
Really is. And now we're going to turn our attention to the private sector.
Okay.
Can they offer a viable way forward? Or do they just add another layer of complexity to this whole situation?
That's the big question, isn't it? There's no easy answer. We have to weigh the pros and cons, see how they fit in with the government's initiatives.
All right, so let's map out the current private healthcare landscape in Assam. What does it look like right now?
Well, you've got your big names, established players like Apollo Guwahati, Nemcare, Hayat, GNRC.
Those are the familiar ones.
They are. They offer specialized services, advanced tech, all that.
So the high-end stuff.
Yeah, but mostly in the cities.
So even with private options, accessibility in rural areas is still a problem.
It is.
What are the main factors holding back private investment in healthcare, especially in those underserved regions?
Well, the same geographical challenges we talked about before.
Right, the remoteness, the floods.
Yeah, exactly. It all adds up to higher costs for the providers, logistical nightmares.
So I get why businesses would hesitate to invest in those areas.
Of course, the risks are high.
But couldn't you argue that private players could fill the gaps where the public system is struggling? Could incentives be the answer?
That's definitely an approach worth considering.
Okay.
The government could offer things like tax breaks, subsidies, even land grants to encourage these private hospitals to set up shop in smaller towns, rural areas.
That's interesting. But wouldn't there be concerns about profits being put ahead of patients?
Yep.
How do you ensure that private involvement actually leads to better health care for everyone, not just those who can afford it?
That's where regulation comes in. You need strong oversight, transparency in how things are run, clear rules.
This is a balancing act.
It is. You want to incentivize investment, but also protect the most vulnerable people.
Right, because it can't just be a free-for-all.
Exactly. And this is where the idea of public-private partnerships comes in, or PPPs for short.
PPPs. Now, for our listeners who might not be familiar with that term, what exactly are they and how could they work in Assam?
In simple terms, it's the government and private companies teaming up to provide services.
What?
Like, let's say the government provides land and basic infrastructure.
Okay.
And a private company sets up and runs a diagnostic center in a rural community health center.
Interesting.
So both sides benefit, right? The government gets help in providing these crucial services. The private company gets a new market. They're also contributing to a good cause.
A win-win, ideally.
Exactly. And there are so many different PPP models you could adapt to Assam's needs.
Like what? Give me some examples.
Well, telemedicine's a big one.
Yeah, we touched upon that earlier. I'm curious how a PPP can make that happen.
Imagine a specialist in Guwahati consulting with patients in villages via video conferencing.
Okay.
A PPP could involve the government setting up the internet, the equipment in those rural health centers.
Right.
And a private company provides the telemedicine platform, the tech support.
That would be huge for those patients. No more long, difficult journeys.
Exactly. But of course, reliable internet in those areas is a whole other issue.
Yeah, that's a big if, isn't it?
It is, which is why these PPPs could also help with upgrading infrastructure, ensuring connectivity.
So we're talking PPPs for diagnostics, telemedicine, infrastructure.
It's a whole toolbox of possibilities.
It does seem promising. But are there any potential downsides to relying so heavily on PPPs? What could go wrong?
Well, there's always the risk of costs spiraling out of control, or the private partner focusing more on profit than patients if the contract isn't carefully written.
Right, because at the end of the day, it is a business for them.
It is. So you need that transparency, those strong regulations to prevent those problems.
It sounds like these PPPs really hinge on a true partnership.
They do.
Where both sides are equally committed to improving healthcare.
Absolutely. It's not about replacing one sector with another.
Right.
It's about finding ways they can work together, complement each other.
To meet the needs of the people.
Exactly.
It's complicated, that's for sure. But it's encouraging to see that these innovative approaches could lead to real change.
They could.
We've looked at the private sector's potential, the promise of PPPs. Now let's get into specifics. What policies could actually turn these ideas into reality?
That's the next step, taking action.
And that's what we'll be diving into in the final part of our deep dive, so stay with us. Welcome back to the deep dive. We've been through quite a journey, haven't we? The government's initiatives, the private sector's potential, the whole PPP concept.
A lot to unpack.
It is. But now it's time to shift gears. From analysis to action.
Okay.
If we were in charge, what concrete steps would we take to actually make a difference in Assam's healthcare?
That's the key question, right? Moving beyond just talking about the problems.
Right, finding solutions.
And I think a multi-pronged approach is crucial. You can't just fix one thing and expect everything to magically get better.
So if you had to pick one area to really focus on, where would you start? What's the top priority in your mind?
I'd say tackling the doctor shortage, especially in rural areas.
Okay, yeah, we've talked about that a lot.
Because it's the foundation. You can have the best hospitals, the most innovative programs, but without enough doctors and nurses.
Yeah, it's pointless.
It is. It's like having all these fancy ambulances, but no one to drive them.
Right, so how do you actually make those rural postings more attractive? We talked about the challenges. Lack of resources, isolation.
It's tough.
It's a hard sell.
It is, but I think we need to think outside the box. What about big financial incentives?
Okay, like what?
Significantly higher salaries for doctors and nurses willing to work in those areas.
Could make it worth their while financially.
Exactly. Housing allowances, maybe even help with their kids' education. Sweeten the deal.
Make it a real package.
Right, because it's not just about the money. We've established that.
That's the whole lifestyle.
It is. So invest in infrastructure.
Right.
Comfortable housing for them, good schools for their kids, even things like recreational facilities in those rural areas.
Make it a place where they'd want to live.
Exactly. Instead of it feeling like a punishment, frame it as an opportunity.
Right, a chance to actually make a difference.
Absolutely. And professional development is crucial too.
Okay, yeah. So they're not just stuck out there.
Right. Specialized training, maybe using technology for remote mentoring.
Keep them engaged.
Exactly. So we've got the financial incentives, better infrastructure, targeted training.
A whole support system.
It is. But now let's talk about those specialized hospitals.
Okay, yeah, concentrated in the cities.
We need to move away from that Guwahati-centric model.
Spread things out.
Yes. More specialized hospitals in smaller towns, strategically located across Assam.
So people don't have to travel so far.
Exactly.
Yeah.
But obviously, building hospitals takes time.
Yeah, it's not an overnight solution.
It's not. So in the meantime, technology can help bridge that gap.
Like how?
Well, we talked about telemedicine, But what about mobile diagnostic units?
What, like a clinic on wheels?
Basically, equipped with the latest imaging technology, they go to the villages.
Wow, that's amazing. Bringing the services to the people.
Right. And then you've got AI, data analytics.
Oh, yeah, everyone's talking about AI these days.
For good reason. It can analyze medical data, help doctors make faster, more accurate diagnoses.
Like a super smart assistant.
Exactly. Imagine an AI system that can predict your risk of certain diseases based on your history.
That's kind of scary, but also very cool.
It is. But we have to be careful, right? Technology should empower healthcare workers, not replace them.
It's about finding that balance.
It is. Maybe AI can handle the paperwork so doctors and nurses have more time with patients.
More human interaction.
Exactly. It's a weird thing, isn't it? Using cutting-edge tech to solve these basic healthcare problems.
It is. But it's also exciting.
It is. It's about making quality healthcare accessible to everyone, no matter where they live.
And let's not forget about education.
Oh, absolutely crucial. Public health campaigns, promoting healthy lifestyles, early detection.
Give people the knowledge to take care of themselves.
Exactly. So we've got a lot of pieces to this puzzle. Skilled workers, better infrastructure, smart use of technology.
And empowered individuals.
It all has to work together.
It's a team effort, really.
It is. The government, the private sector, healthcare workers, individuals.
Everyone has a role to play.
Absolutely. And that brings us to the end of our deep dive into Assam's healthcare.
It's been a fascinating journey.
It has. Complex issues, no easy answers.
But hopefully we've sparked some new ideas.
I think we have.
And shown that healthcare is about more than just hospitals and doctors.
It's about people.
It's about communities. It's about all of us working together.
Absolutely. So thank you for joining us on this deep dive.
We hope you learned something new and maybe even feel inspired to be part of this conversation.
We all have a part to play.
That's right. Until next time, stay curious and stay well.